Your Majesty, we have already tackled the first systems affected by systemic lupus erythematosus. I will now delve more on the other systems affected. First, the cardiovascular system. To further understand the process of the disease, I will first discuss the anatomy and physiology. The heart is situated in the center of the chest. It is a hollow muscular organ. It is divided into two sides, the left and the right. Each side is an upper chamber called the atria, which collects blood, and the lower chamber called the ventricles, which eject blood. The carbon-laden and oxygen-depleted blood goes into the heart through the largest veins in the body, called the superior and the inferior vena cava. It will now drain into the right atrium, to the right ventricles, via the tricuspid valve that prevents the regurgitation of blood. It will now go to the lungs via the pulmonary artery, and after the lungs for oxygenation, it will now go to the pulmonary vein, to the left atrium, to the left ventricle via the mitral or the bicuspid valve that also prevents the regurgitation of blood. After that, it will go to the aorta via the aortic valve and then into the circulation. And now, Your Majesty, since you have decreased the absorption of fluids in your kidneys, there will be increase in venous return, there will be increased supply of blood to the heart, and there will be increase in the hydrostatic pressure, causing the shifting of fluids from the intravascular to the interstitial spaces, causing now pericardial effusion. If there is pericardial effusion, there will be increase in cardiac workload, and increase in cardiac workload will lead to tachycardia, and increase in cardiac workload will also increase the fibrosis of the heart, leading now to cardiomegaly. So what were the diagnostic tools utilized to confirm the diagnosis of the patient?
Two-dimensional echocardiogram is capable of displaying the cross-sectional view of the beating heart. It includes the chambers, the valves, and the major blood vessels that exits from the left and the right ventricle. The Queen's 2D echo has the remarks of normal mitral valve leaflet, aortic valve leaflet, tricuspid valve leaflet, pulmonic valve leaflet, bilateral left ventricle division with normal valve contractility, and has the result of pericardial effusion.
With the presence of the pericardial effusion, there is increase in the cardiac workload. Increase in cardiac workload will increase the fibrosis of the heart. If there is decreased fibrosis of the heart, specifically the left ventricle, it led to the development of bilateral left ventricle division. If there is fibrosis and division of the left ventricle, there will be now decrease in the capacity to accommodate blood. If there is decreased capacity to accommodate blood, there will be backflow of blood from the left side of the heart to the pulmonary system or the respiratory system, causing now the increase in the hydrostatic pressure, causing the shifting of fluids from the intravascular to the interstitial spaces of the lungs, causing now pulmonary edema. Since we have already tackled the respiratory system, I will now go to the respiratory system, Your Majesty. To further understand the process of the disease, I will now first discuss the anatomy of the physiology. The respiratory system begins with the nose and mouth and continues through airways to the lungs, where oxygen from the atmosphere is exchanged for carbon dioxide from the body's tissues. The lungs, which are the largest parts of the respiratory system, look like large pink sponges that almost fill the chest. The left lung is a little smaller than the right lung because it shares space with the heart and the left side of the chest. Each lung consists of lobes or sections, 3 to the right and 2 to the left. The primary functions of the respiratory system are to bring oxygen to the lungs, to transport oxygen to the blood vessels, and to expel the waste product called the carbon dioxide. First, the air enters through the nose or the mouth and is brought down to the pharynx or the throat. The pharynx has 3 parts, the oropharynx, the laryngopharynx, and the nasopharynx. And if the air enters the pharynx, it will now go down to the larynx or the voice box. The entrance to the voice box or the larynx is controlled by a muscular flip-flop tissue called the epiglottis, which closes during swallowing, thus preventing the entrance of food to the lungs. The largest airway in the respiratory system is called the windpipe of the trachea, which is further divided into two smaller airways, or called the bronchi that supply the lung. The bronchi themselves divide many times before evolving into much smaller airways called the bronchioles. The bronchioles are the smallest airways in the lungs with a size of 1/50th an inch across. And this particular part of the respiratory system look like an upside-down tree, which is why this is called the bronchial tree. At the end of each bronchiole can be found dozens of air-filled bubble-shaped cavities called the alveoli. And these alveoli can be found in each lung, millions of them. And each alveolus is surrounded by a dense network of capillaries. And the extremely thin wall of capillaries and the alveoli allow the transport of oxygen from the lungs to the blood vessels, as well as the movement of the carbon dioxide from the blood vessels to the lungs and the heart for expiration or exhalation. Now, my queen, since you have the systemic lupus erythematosus characterized by systemic inflammation, there are depositions of immune complexes specifically in your lungs, and these immune complexes trigger the type 3 hypersensitivity or the immune complex hypersensitivity. If there is increase or hypersensitivity, there will be release of inflammatory mediators, specifically the complement system, the bradykinins, the histamine, and the interleukins. And these interleukins, specifically the interleukin-1, stimulates the hypothalamus with this thermoregulatory function. Increasing this function results to fever. With further inflammation, there will be increase in capillary permeability due to vasodilation, and with the process of chemotaxis, there would be release of neutrophils to the site. And with the neutrophils, as part of the immune system, is an attempt to engulf the immune complexes. If this would be the immune complex, and this would be the neutrophil, due to its size, it is smaller than the immune complex. It will launch into the immune complex. Due to its size, it cannot engulf all this immune complex. Instead, the lysozymes that can be found in the neutrophils will leak into the tissues of the lungs. If this would leak, this would damage the tissues of the lungs, causing now altered or impaired oxygen supply or oxygen and carbon dioxide exchange, mismatch in the ventilation perfusion, causing now dyspnea, tachypnea. Since there is also increase in capillary permeability, there will be leakage of fluids from the intravascular to the interstitial spaces of the lungs, causing now and aggravating pulmonary edema. If there will be altered exchange of gases in the lungs, there will be decreased delivery of gases, specifically oxygen, from the lungs to the blood vessels, causing now hypoxemia. If there is decreased delivery of blood from the blood vessels to the tissues, this will now cause hypoxia. If there is hypoxia, the compensatory mechanism of the heart is to pump more oxygenated blood to the system, aggravating now the function of the heart, causing more workload. And if there's more workload, there would be fibrosis and aggravate cardiomegaly. So what were the assessment, diagnostic tools utilized with the respiratory system?
During the assessment of the respiratory system, the queen was observed to have